Welcome back. I'm Mary Story from the University of Minnesota, and I'll be kicking off this next session, which is making healthy foods and beverages available and combating inequities in food and beverage environments in ethnic minority and low-income communities. Now, following my tee-off, we're going to have two presentations by Tracy Fox and Donald Schwartz, and I'll introduce them right after my comments. This isn't advancing. Okay, so the goals from the APOP report, there were 5 goals, and the second one that we'll be talking about now is making healthy foods available everywhere. And so this was one of the cornerstone goals of the APOP report, but we know that healthy foods are not available everywhere, especially in low-income communities and ethnic racial communities. Studies from the 1960s on have consistently shown that large suburban supermarkets have the lowest prices, whereas small grocery stores and convenience stores, which are much more common in poorer neighborhoods, have the highest prices. We also know that fast food restaurants are more common in low-income and ethnic minorities, and we also know that marketing of these unhealthy foods are more prominent in low-income and minority neighborhoods. And we further know that schools in low-income communities are more likely to be surrounded by convenience stores and fast food restaurants. And Hispanic and Black students are more likely to be in schools that are surrounded by convenience stores and fast food restaurants. And this is independent and in addition to poverty, and this is what Shriki had mentioned this morning. So the whole focus on environmental and policy change really, I think, has been accelerated in the last 15 years. And the first report, the Surgeon General's Call to Action in 2001, I think really set the stage that individual behavior change can only occur in a supportive environment with accessible and affordable healthy food choices. Before this, I think the focus was really on individual behavior change. So this report really set the stage. And then the Preventing Childhood Obesity, Health and the Balance, which I think was just a brilliant report, came out in 2005 and really reinforced this notion that it's unreasonable to expect people to change their behavior when there's so many forces that conspire against us. So the recommendation for the food and beverage environments in the APOP report to make healthy food available everywhere was that governments and decision makers in the business and private sector community should make a concerted effort to reduce unhealthy food and beverage options and substantially increase healthier food and beverage options at affordable and competitive prices. And in the APOP report, they had 5 food and beverage strategies that could be used to really accelerate progress in reducing childhood obesity. And I'm just going to say a few comments about each of these, starting with the first strategy, which is to adopt policies and implement practices to reduce overconsumption of sugar-sweetened beverages. I think this is an important strategy because we know that consumption of sugar drinks is one of the major contributors to calories and added sugars in the diet. And the most recent Haines data among 2 to 19-year-olds found that on any given day in the U.S., 70% of males and 60% of females between the ages of 2 and 19 consume sugar drinks. So that's, between 2 and 19, 70% of boys and 60% of girls. And these intakes are higher among Black, Hispanic, and American Indian youth, as well as low-income youth. Now, a study that Shriki mentioned was just released ahead of print 2 weeks ago in the American Journal of Clinical Nutrition. And they looked at trends in sugar-sweetened beverages among youth from 1999 to 2010. And this was done by Cynthia Ogden and her team of researchers from the National Center for Health Statistics at CDC. And they found that there has been, over the last in this 10-year period, a decrease of 68 calories per day for children 2 to 19 in their intake of sugar drinks. But intakes were still higher among Black, Hispanic, and low-income children. But they found that there was a decrease in energy intake from sugar drinks for all age groups and race ethnicity groups, except among Black children ages 2 to 5. And Black preschoolers, and this was Haynes data from 2009-2010, Black preschoolers consumed 114 calories per day in sugar drinks compared to 61 calories for whites and 72 calories for Mexican American children. This is a lot of calories for 2 to 5-year-olds. And that the highest intake of sugar drinks was teenage boys. Black teenagers consumed 228 calories per day in sugar drinks, Mexican Americans 249 calories. And these same drinks are really heavily marketed, which we'll hear about tomorrow, to ethnic minority and low-income youth. And I know from working on Indian reservations and even in some of the urban cities, you can get those big gallons now of sugar water that are those bright green or purple. And I was on the reservation not that long ago, and they were like 69 cents for a gallon. So they're so cheap, they're really heavily promoted, and it's just really sugar water. So some action steps that I think that could be taken and should be taken to achieve equity and also just reduce sugar-sweetened beverages are to ban sugar drinks in schools and other settings where children are cared for. Now, the latest data from Bridging the Gap, a national survey, found that 14% of elementary schools had access to sugar drinks. So there really has been a decrease in this area. 65% of middle schools currently have access to sugar drinks in schools, but 90% of high schools. So I think the high schools and middle schools are an area that we really need to have stronger policies to really to ban any sugar drinks. I think in order to really reduce sugar drinks, we have to come up with more creative approaches for promoting tap water. And to reduce sugar drinks, bottled water is healthier, but it's not affordable, and tap water has so many benefits. And I think we really need kind of a national campaign to promote tap water. Clean drinking fountains and conveniently placed water stations, hydration stations are an easy way to increase tap water, especially in low-income and minority neighborhoods. And in Minnesota, they've recently had several initiatives to increase the use of free, safe drinking water. The city of Minneapolis created what they called Tap Minneapolis, and this was first of all, they had a campaign to really promote the awareness of drinking tap water. And they had taste tests, blind taste tests, and most people couldn't tell the difference between tap water and bottled water. In fact, many people preferred the tap water. And also, there's been studies that have shown that bottled water is no more pure than tap water. So some of these campaigns really address this. They also, Tap Minneapolis provided portable drinking fountains for large public events. And the city recently funded 10 new water fountains throughout the city that were designed and built by local artists. I'm at the University of Minnesota, and I've noticed that a lot of the water fountains have been replaced by bottle filling stations, and those are really becoming increasingly popular in government work sites and across college campuses. But I haven't seen any of these in schools or in a lot of the places where children play, like in in after-school programs. Some institutions nationally are implementing creative approaches to increase awareness and access to tap water, such as signage near vending machines, signaling the closest public water fountain, which I think, certainly could be used. And I think some of the issues that we need to deal with is, Minnesota has a lot of immigrant populations, and a lot of immigrant populations, healthy, safe water is not available in countries where they're coming from. So I think there needs more work to really promote tap water in communities where a lot of immigrants are settling. Another area that I think is really promising to reduce sugar drinks is providing calorie information. And Sarah Blake, I was going to talk about her study, and she's in the audience sitting over there, a researcher at Johns Hopkins University. And I think she did a really innovative study that really looked at the effect of an intervention to provide calorie information about sugar beverages in Four Corner stores in low-income Black neighborhoods in Baltimore. And they looked at, the outcome was beverage sales among Black adolescents, and the study was published in the American Journal of Public Health. But they posted bright signs in the corner stores by the beverages that had the calorie information. So some of the signs were, did you know that a bottle of soda or juice has about 250 calories? And then another sign was, did you know that a bottle of soda or fruit juice has about 10% of your daily calories? And the third condition was, do you know that working off a bottle of soda or juice takes about 50 minutes of running? Now, which one of those would you think would have had the most effect, or the least effect? Or well, let's say the most effect. Sarah, you can say. The running. So I think, and they found that having that sign, do you know that a bottle of soda or fruit juice, it takes 50 minutes of running to burn that off, that reduced sugar drink purchases among Black low-income youth. So that was point of purchase. So I think strategies such as this, I think, should really be utilized. And then I think we'll be talking more today about strategies strategies such as the taxing strategies, and I think Don Schwartz will be one of the presenters, and we'll be talking about what his experience in Philadelphia and what we've learned from that. So there's also many other strategies, I think, that need to be really promoted in communities with restaurants, the nutrition standards for all foods and beverages sold throughout the government, and the government procurement, I think, has really taken off in a lot of communities. And then also an area that we'll talk about today is food and beverage and retail marketing in stores. And I think where there's been a real effort to have grocery stores in low-income communities, which is really, I think, essentially needed. There's been less work on bringing grocery stores into communities. While it's very important, there's also a lot of unhealthy foods in grocery stores. And very little work, I think, to date has been done on what we can really do in terms of marketing healthier products, and then also reducing access to the unhealthier foods. And then the last strategy in the APOP report was to look at agriculture policies on diets and obesity. And I think if we really want to reduce obesity in this country and have people eating healthier, we really have to look at these larger food system issues and our policies, agriculture policies, that are not really aligned with health promoting and obesity prevention efforts. So on our panel, and we have in your booklet is the biographies of the speakers. So I'm going to just really introduce them briefly. Tracy Fox is the president of Food, Nutrition, and Policy Consultants. She has over 25 years of experience working in the federal government and the private sector. Before this, she was a policy analyst with the USDA's Food Nutrition Service and the Academy of Nutrition and Dietetics in their Washington, D.C. office. And she is the past president of the Society for Nutrition Education and Behavior. And Tracy is going to be talking about policies for these strategies. Don Schwartz is the Deputy Mayor for Health and Opportunity and Health Commissioner in the City of Philadelphia. The City of Philadelphia has done, I think, one of the most impressive jobs in the country for really changing the whole milieu of the city. And I was looking at the annual report, Get Healthy Philly, which was from the Philadelphia Department of Health, and it really is online, and it really outlines all the efforts that they've done. And I think they really can be a model for what's being done, or what could be done in the rest of the United States. So our first panelist will be Don, and he's going to be talking about his experience with Get Healthy Philly. And then that'll be followed by Tracy Fox, who will be talking about some policy solutions and policy approaches. So I would like to welcome Don from Philadelphia.